Good everyone. I hope you guys have an amazing day. So what I'm going to do today, I will discuss briefly about advanced therapy management. So this is most likely going to be a theory. Um, so so now, what is an advanced therapy management? You might wonder, right? I mean, the word looks fancy. So think about this scenario, right? Um, so usually, you know, if you're a person who struggles with, let's say, something to do with the gene disorder, or say, some kind of cancer, or something which is complicated, right? Then usually hospital refers you to a certain kind of therapy, right? Could be a cell therapy, or I'm not a doctor, but I just saying could be a gene therapy, or could be something, right? Um, so when that scenario happens, right? Obviously, one thing you need to understand there, right? One size doesn't fit for all, right? So what therapy that worked for one person may not be good for another person. So usually pharmaceuticals, right? They often get involved in making a custom tailored therapy for a patient, so that they can get the best out of it, right? Obviously, pharmaceutical is an exciting place to be in. The reason why a lot of cutting edge stuff happens in pharmaceuticals, right? Because they obviously, there are a lot of misconception that, oh yeah, pharmaceuticals, or they make a lot of money by selling the drugs. Obviously, they have to make money by selling the drugs, right? Because they are the one who coming up with all kind of research, right? And the research costs money, and people won't come and work for free, right? Think about it, right? Would you work for a company free? Would you go and work, let's say, a Salesforce company? If Salesforce says, hey, come and work for us, but we're not going to pay you money. I will tell you, right, no matter what people talk about philanthropy or goodwill, they will not be willing to work for free, right? Well, let's accept the fact, right? And easy to talk than implementing the stuff. So that's why the pharmaceuticals needs to make sure that they get the best talent and pay them well, right? So they can stay and invent stuff, right? So obviously the pharmaceutical charges money, right? So that's why I have a lot of respect for them, because obviously they are an industry of saving lives. They make medicine. Think about the painkillers, right? Think about a scenario today. Imagine there's no painkillers anymore, and that will be very unpleasant experience, right? If you get a pain, that's a kidney stone, right? Imagine there's no, ibuprofen or codeine or whatever, right? Yeah, it's gonna be a nightmare to deal with a kidney stone, right? So that's one of the reasons why I have a lot of respect for pharmaceutical. I'm not a doctor. I'm not a genetics guy, engineer, but I've seen what they've done and the good thing they do for the society. Yes, and they deserve to make money, right? Because they're in the business. They're not in the charity. Right. So enough of rant. Let's take an example of Charles Green, right? Now, Charles Green, let's say he's been diagnosed with a cancer. He visit hospital, right? And hospital says, that's interesting. So the specialist, had to take a look at him and said, okay, I think it's better he involved in a certain kind of therapy, let's say cell therapy. And so they put him in a care program. And in the care program, obviously, right, when you're using Health Cloud, so first thing you need to do, you need to enroll in a care program. And obviously, then, you need to schedule, appointments for different things, right? Infusion and other stuff. And that's exactly where the advanced therapy management comes in picture, right? So if you're interested, you can go through this trailhead. It talks about the cell therapy, isolation, engineering, growth. They talk a little bit about the genome and T cells and kind of stuff, right? It's a pretty exciting tech, right? Then they talk about apheresis and manufacturing, infusion. So let's say, um, Charles Green has to go through all these three. So they need to schedule an appointment for all of this stuff, right? And how do you do that? There's an option in advanced management to do that. I'll show you in a second. So why advanced therapy? You can say because it consists of one-off treatment, opposed to traditional treatment, right? Makes the physician-patient engagement more patient-centric. This is the most important thing, right? In my opinion. So if you are going to do a therapy, right, it has to be patient centric. It shouldn't be a doctor centric or hospital centric or pharma centric. It should be patient centric because at the end of the day, you're trying to cure a person, right? So it should be based on that person need and well-being, right? And leads to better health outcomes and improved adherence due to its proactive preventive approach, right? Then it provides precision care that reduce adverse drug reaction. Obviously, imagine if you're not talking about from a patient care, right? Then if you remember, I mentioned something called one size fit for all solution will not work. The reason why I say, right, what will happen if one size fit for solution has been applied and the person might have an adverse drug reaction to certain drugs, right? Because not everybody responds to the same treatment in a similar fashion, right? Some might have adverse reactions. Some people may not have anything at all, right? So you need to make. So that's one of the reasons why I say the pharmaceuticals are trying to make a patient-centric approach, right? They custom tailor solution for a person, which works for the person, right? And lower medical costs, of course, right? Obviously, you cannot charge a person fortune, right, to get him get treated. Obviously, there should be a balance between the money a farmer needs to make and the patient care, right? So that's in a simple nutshell, right? And if I look at other option, explore multi-step scheduling. This is the one I'm talking about. I talked about, right, all the three process, right? Um, so all of this. So when you enroll child screen to those three things, right? Infusion, manufacture, and other stuff. Uh, you need to. This all objects comes into play, right? So the work procedure, work procedure step, work procedure, care program, enrollee. So this is the child's account, child screen person account is enrolled, right, for this care program, and this is a work procedure, and different number of procedures will be involved, and the place the person will be doing this, right? So this is how a data model is about. Very simple, right? There's nothing complicated here. So they use territory management. If you have done a service cloud, or if you have done what's that called, sharing architect certification, you will know about the service territory management. So that's in a nutshell, right, how the data model works behind the scene. Child screen, get enrolled here for this care program, and to do this work procedure, right, and to do this location. Pretty simple, right? Okay, now let's look at the org, how it looks like. So we got an app here. I mean, obviously, I'm using the trial version. So you go for Advanced Therapy Management. It's so it contains three, two. I mean, you can add as much as you want, but these are the most important. The care program enrollee. So you enroll child screen, right? And so you go here, child screen is there, and the person is enrolled for the care program. So right now we got two care programs here. Come on. Diabetes and chronic pain, right? Obviously, we can put cancer or whatever. Um, so this, if you look at here, enrollee and this enrolled for this, right? And then the work procedure. So if you look at the work procedure, right, we got work procedure, and that work procedure will be linked to work procedure steps, right? It's pretty simple. So this is a work procedure, all right, and this work procedure might have uh, related. So these are the three work procedure steps, right? The Mr. Charles Green would be going through. we'll have to go through. So yeah, that's from a data model perspective, right? And now what JavaScript can do, you can also book an appointment slot here. You can book the slot. So you can actually book a slot for child screen to say, hey, obviously that person needs to do these three things, but needs to be booked at first place, right? They can't go and do it's like it's simple thing, right? You go to hospital, you obviously need an appointment. You can't just go in unless it's an emergency. That's a different story. But for a general case, right? Let's say you wanted to meet a physician or you wanted to meet a specialist, right? Let's say urologist, then obviously you need to have a pre-booked appointment, or for say, or to remove a kidney stone, or surgery, they need to book you in, right? So you can do something like here, book a new slot, and you can look for the work procedure, um, and look for the organization, what do you want to do, and type of, and start date, end date, and work type, right? And you have a work location, right? You can select it. I don't think so. I have any data, but let's see. I don't. No, I don't go. I'll go now. So if you have something, excuse me, don't know what happened to my throat today. If you got something, right, you can schedule that appointment. So it's that simple. I haven't used advanced therapy management as a part of my health cloud work experience, but I've heard people using it, at least in the United States. New Zealand, I haven't heard, to be honest. So, for a New Zealand user, for a New Zealand consultants, this may or may not be useful, but it is an option there in the health cloud. And yeah, from an exam perspective, right? We got so it's an accredited certification. You can't just go to your um, the regular certification option and take it. You need to have a partner program in place, and you need to have a login there, and you can take it from there. So I would encourage you guys to take it if you're really into health cloud, you're working with the health cloud. But just for the sake of health cloud, please don't take it, right? As I've been telling, I'm sick of telling people, right? Certification is not a number game. Just because you got 50 certs doesn't mean that you will get lots of money. It doesn't work that way, right? I mean, like I said, if I hire somebody, I wanted to know, can that person do the job? Think about this, right? You hire a carpenter in your home, right? Would you care about a carpenter who actually know how to do the job, or would you care about the carpenter with too many certifications who just talk, right? I obviously don't care if he got any cert or not, as long as he can do the damn thing. I'm fine with it. I'll rehire him. That's the same thing goes for me in Salesforce space. If a person talks, can't deliver, it's not gonna work out with me. I'm afraid. That's why I often say, right? I have very high benchmark expectation, right? That's me, right? Because I take my job, I take very high pride in my job, or any work I do for that matter, right? Because it's one life, each day you're losing a part of your life. And, the way I look at it, if I'm not capable of doing something, I'll make sure I learn it and I give my best. If still is not good enough, I walk up, right? That's the way I do. I don't like to stick around and create a mess. People give so much excuse. Oh, we're gonna do this, we're gonna do that. Nobody cares. What matters is, can you deliver the damn thing? If you can't, you're not gonna add any value to the company. End of story. You know, because it is a world of rising artificial intelligence. What can you do different which AI can't? That's the question you should be asking every single day. And if you think you can do something better, you will have no problem with employment whatsoever. If you think you can, I'm afraid it's going to be a bumpy ride, right? Like I said, I'm a person known to be extremely blunt, so my apologies if it's offended anyone, but I'm just making a clear statement, right? If you're not going to work with the health cloud, please don't take it. I mean, you can learn it, but what's the point of taking a certification, right, when you don't want to use it? Like, I don't go and take marketing cloud because I don't use those things. As it's pointless for me to go and learn marketing cloud. Yeah, from a general knowledge perspective, I can go through Trailhead and get the stuff around. That's fine, but I don't need a cert for it, right? So, and don't get me wrong, I teach people to get certified, and so when I say it's if you're not going to take if you're not going to use Health Cloud, so don't take it. I really mean it, right? So yeah, that's pretty much I wanted to cover in this episode. Hope you guys have an amazing Wednesday. Adios.